Welcome to the Explainer. Have you ever wondered what's really going on when your legs ache or swell or when you see varicose veins? Well, today we're going to put on our detective hats because we're investigating how doctors diagnose the hidden culprit, vein disease.
Right, let's just dive straight in. It's a question so many of us have. That nagging ache, the swelling, those visible varicose veins, they're all super common signs of what doctors call chronic venous disease, or CVD. But what is actually happening underneath the skin?
To really get to the bottom of this, doctors can't just look at the surface. They have to become diagnostic detectives. They're piecing together clues about the pressure inside our veins, how well our muscle pumps are working, and the overall flow of blood making its way back to the heart.
Okay, so our investigation is going to start with the most basic question. What is actually going wrong inside these veins that's causing all the trouble in the first place? When you boil it all down, CVD is basically a plumbing problem. Seriously. Think of your veins as a system of pipes with these clever one-way valves, all designed to keep blood moving up, fighting against gravity. But with CVD, those valves get leaky or the pipes get blocked. And when that happens, blood starts to pool, pressure builds up, and boom, that's when the symptoms appear.
So, when our diagnostic detective shows up at the scene, what's the first tool they reach for to get a look inside? Well, in most cases, it's going to be an ultrasound.
And we're not talking about just any old ultrasound. This is a duplex ultrasound, and it's pretty cool. It uses sound waves to create a real-time live map of your veins. It lets doctors see the actual structure, the anatomy, basically the layout of all the pipes, so they can check for things like blockages. But, and this is a huge but, there's a critical limitation. You can see it right here. While the ultrasound is fantastic for mapping out the anatomy, the physical pipes, it doesn't really tell the whole story about the function, how well the blood is actually flowing. In fact, some studies show that what the ultrasound measures doesn't always line up with how severe the disease actually is for the patient. The map, it turns out, is not the whole territory. So, to get that true picture of function, our detective needs to go deeper. They need to measure the pressure inside the veins directly. And for a long time, this was considered the absolute gold standard. This brings us to a test called Ambulatory Venous Pressure, or AVP. And for decades, this was it. This was the benchmark for accuracy. It was the test that all other tests were compared against. So how does it work? Well, first, a small needle is put into a vein in the foot to measure the pressure. Then, the patient does a really simple exercise, just 10 tiptoe stance. This little action fires up the calf muscle, which is often called the body's second heart, and that shows doctors exactly how well it's pumping blood upward and bringing that pressure down. And the results? They show a really stark difference. I mean, look at this. In a healthy leg, the pressure plummets by more than half, and it takes over 20 seconds for the veins to fill back up. But in a leg with CVD, the pressure barely moves, and the veins refill almost instantly. It's a crystal clear sign that the system just isn't working right. Now, AVP is incredibly accurate, no doubt. But it's got one big catch. It's invasive. Sticking a needle into a vein, well, it isn't exactly ideal for patients, and it's not great for routine testing either. This one major drawback created this huge need for a better, non-invasive way to get the same critical information. And that need is what leads our detective story to the modern toolkit, a whole set of methods designed to measure function without using a single needle. This modern toolkit is built on something called plethysmography. It's just a fancy word for a way of measuring changes in volume. To make it super simple, think of your leg like a sponge. These tests basically measure how much water, or in this case blood, the sponge can hold, and how efficiently you can squeeze that water out. There are actually a few different ways to do this, using all sorts of technology, from electrical resistance to infrared light. But one of these methods, Air Plethysmography, has really emerged as the most complete tool for getting the whole picture of vein function. And that brings us to the star of our modern toolkit, Air Plethysmography, or APG. This is the technology that gives our detective those final, super detailed clues needed to crack the case of chronic venous disease. The setup is actually really straightforward. A long air-filled cuff gets wrapped around the patient's leg, kind of like a boot, from the knee down to the ankle. By measuring teeny-tiny changes in the air pressure inside this cuff, APG can precisely quantify 3 absolutely critical factors of vein health. So APG gives us these 3 key metrics that, when you put them together, give you a complete picture. You've got the venous filling index, or VFI. That's how fast blood rushes back into the leg. Then there's the ejection fraction, or EF, which shows how well that calf muscle pumps blood out. And finally, the residual volume fraction, or RVF, which tells you how much blood gets left behind. Let's start with VFI.
And this is where the data gets incredibly powerful. There is a direct, stark link between a high VFI number and the risk of serious problems. I mean, just look at these numbers. In legs where the VFI was over 10, a staggering 58% had developed skin ulcers. This metric isn't just a number, it's a direct link between how the vein is functioning and what's happening to the patient.
Okay, next, APG gives us two key numbers about that second heart, the calf muscle pump. First is the ejection fraction, the EF. That's how much blood gets pumped out with just one calf flex. A healthy pump? That should be over 60%. Then it measures the residual volume fraction, or RVF, what's left behind. And in a healthy leg, that number should be nice and low, less than 35%.
So, at the end of the day, no single test tells the entire detective story. As you can see here, the very best diagnosis combines the anatomical map you get from the ultrasound with the crucial functional data about flow and pump efficiency from the APG. It's all about putting all the clues together to see both the structure and the function.
And just as our source material says, the verdict is pretty clear. A comprehensive approach, using all the right tools to understand both the anatomy and the physiology, is the absolute key to properly managing and treating vein disease. Case closed.
And that leaves us with a really fascinating thought for the future. Remember photoplethysmography, or PPG? Well, believe it or not, that's the same exact science your smartwatch is using right now to check your pulse. So as this tech gets smaller and smarter, could preventative vein health monitoring one day be something you just check on your wrist? And that's our explainer on the diagnostic detective story behind venous disease. Thanks so much for watching.